In this episode of the Nurse Practitioner Podcast, Dr. Jamie Newland, Editor-in-Chief of the Nurse Practitioner, discusses her work with the journal, her career, and our new department, Global Perspectives. Can you tell us a little bit about your role as Editor-in-Chief of the Nurse Practitioner Journal?
Yes, I've been Editor-in-Chief since 2005. I initially started with Wolters Kluwer as a member of the editorial board of AJN, American Journal of Nursing. And for a few years, I was a member of both that journal and the Nurse Practitioner. And I really enjoy the role as Editor-in-Chief because you can sort of set the tone for the journal and also set standards. And of course, we strive for excellence, and for up-to-date information, evidence-based, and also selecting the content and helping other authors write and disseminate their information, clinical or research. And the editor has a major role in determining what's published. That is, I review all manuscripts and assign peer reviewers and then review their comments and determine whether there are revisions or whether a manuscript is going to be accepted. And I find that very exciting because I'm able to really read broadly many topics, and it keeps me informed, but I'm always thinking in my mind, what will readers want in a particular article?
When and why did you choose to be the journal's editor-in-chief?
After being a peer reviewer for AJN and the Nurse Practitioner, I felt I had developed certain skills, and I wanted to advance further in the publishing world. And becoming an editor is one way of really advancing those skills. And the editor really works with a team. And I like the idea of having support at Wolters Kluwer and working with others who were dedicated to publishing the best in the field, so that nurse practitioners and other advanced practice nurses could have the information they needed to practice and to educate themselves and their patients.
What's your favorite aspect of being the journal's editor-in-chief?
I really enjoy the variety of manuscripts that we received and the enthusiasm of the authors when they submit. They're very excited, they've done work, and they want to share it with everyone. And that excitement sort of rubs off. But also the raw material that comes in is really, once it goes through the editorial process, transformed into this beautiful, piece of work. And authors are pleased, which makes me pleased. But really, having an impact on nurse practitioner practice and education is important. I am in a position that I can select topics, even for my editorials, that are timely and thought-provoking. And I understand that most readers do read the editorial, almost the first thing. I've even had people, nurses at conferences or even on the subway, someone said, "You look so familiar." And they said, "Well, I'm a nurse practitioner." And I said, "Do you read the Nurse Practitioner Journal?" And they said, "Yes." I said, "Well, I have an editorial every month, and there's a little picture of me in there." And they said, "That's where I've seen you." And so it's very affirming to know that the profession, they do read what I write. And so I think that's important, that I have a voice. And so I'm very careful about selecting topics that I write on.
What's it been like having a hand in developing the nurse practitioner profession internationally?
I've been very fortunate to have opportunities to work with nurses, nursing faculty, and clinicians in other countries, and helping develop nurse practitioner programs. I started as an external moderator for an established program in Botswana. And there I was exposed to the healthcare system and also their educational system through the Ministry of Health, and observing students in the clinical area with real patients. And it was very eye-opening to see how, no matter where you are in the world, nurses really do have a common goal, and that is to provide the best possible care they can to their patients to improve outcomes and also the quality of life. And working with faculty, everyone wants to model their nurse practitioner program after the United States or other fairly developed countries, England or Australia, and they're just eager for guidance. And as the International Council of Nursing states in their definition of advanced practice, everything has to be sort of modified to fit the country. Like what we do in the United States doesn't necessarily work totally in another country. And I've also been able to work with a university in Japan since 2005, and they started their nurse practitioner program in 2008, the first in Japan. And that also has been a very rewarding relationship. I'm still very much connected to them. My last visit there was just September 2018, and now they are looking at outcomes of their nurse practitioner practice. And so helping a country go from conception of the idea to actually developing the program, implementing it, evaluating it, and now disseminating information. It's the whole spectrum. And I recently started working with Lithuania, University of Health Sciences, their nursing, and they started a nurse practitioner program in 2015. And they're moving along very, very nicely. And I have presented with colleagues from there at ICN, and we've also co-authored articles. And so it's an opportunity to really develop long, sustainable relationships, because when one goes into another country to assist, the other country, the nurses there, the faculty there really take the lead. And like I am just someone who is helping to guide but not making the decisions. And so it's very gratifying to see the progress, and in many other countries also, of advanced nursing practice. And I think it's something that will continue, and I encourage anyone who might be interested to see how they can get involved with an international faculty or group of nurses who are interested in elevating nursing. Because what it does, it elevates nursing in general. Because nursing across the globe is not always considered the best occupation or profession, but by bringing more education, better care, better outcomes, everyone will recognize and acknowledge that nursing is actually a very high-level practice.
Can you tell us a little bit about your work in Botswana?
Well, one striking difference I noticed in Botswana was that patients were very accommodating. Whatever you asked them to do, this is while they were in the clinic, of course. that's the only thing I observed, they would do. There were very few discussions because they looked upon the nurse and the nurse practitioner as someone of authority who they didn't really question when it came to their health. And I did visit a rural hospital, and I visited a public hospital, and I visited a private hospital. And in the rural hospital, the operating room looked like it was, decades past. But the workers, the health workers there, they actually do function without all of the conveniences that we have here in the United States. And they do provide excellent care. And so you can do a lot with little. It's easier when you have a lot, but you can do a lot with little.
How about the work that you've done in Japan?
Well, in Japan, one challenge was that I don't speak Japanese. And so many times that I was there, either presenting or just like in a seminar-like setting with either students or faculty or administrators, I would have to have an interpreter. And so you always wonder, are things getting lost in what you said? What you said, is it being translated as you meant it to be or whatever? But it did seem to be that. And of course, there were some who did understand and speak English well. And so they would confirm that, yes, that what I had said was what was relayed to the participants. But Japan, of course, while there, you have to do a little sightseeing and just the history, just thinking back how long ago many of their traditional health practices were started and are still, of course, thriving. There are many who believe in their traditional medicine and still practice it. But there is a way, of course, of combining our sort of Western medicine with traditional medicine. And that was a message that was very clear. And so if you do have the opportunity to do work in another country, you have to always remember to respect their culture, their values, and really see how what information you're bringing to them can fit into their way of life.
And how about your time in Lithuania?
Yes, Lithuania, I have visited twice. I actually, in 2018, was there for 3 weeks as a Fulbright specialist. And during that time, the most exciting thing for me was receiving a certificate of appreciation from the actual Lithuanian Minister of Health during an international nursing conference where I was one of the keynote speakers. And Lithuania, we have a very reciprocal relationship. Faculty, nursing faculty, and physicians from Lithuania have been to the United States. And so our collaboration is very much ongoing, and we really can share our individual and collective knowledge. They are building that particular program there was, in a sense, a little easier because, of course, English, we speak English, and they had also done a lot of homework about the nurse practitioner in Europe and in Australia and other countries. And so it was a matter of finding what fit for them. But that project is still ongoing, and so I'm very excited now that we should start publishing and disseminating the collaboration.
Can you tell us about the Nurse Practitioner Journal's new department, Global Perspectives?
Yes, we have a new department, Global Perspectives, and it is envisioned as a place where advanced practice nurses can go to read about experiences, international experiences, in the sense of helping a country either establish advanced practice or learning about what they might be doing. But many people do have international experiences, but we want to focus more on processes, helping people learn how to make those relationships, how to leverage supports, how to work together, how to put in place strategies where the project or whatever it might be will be sustained, making sure there are champions for it, and also disseminating information about all of those things. The journal does have an international editorial board, and so we are encouraging those members to write articles about advanced practice in their particular countries, because it's important for the profession here to know what's going on in other places. And challenges and struggles seem to be the same everywhere. And so solutions in one place might be beneficial in another place. And so we're hoping that anyone who's interested, who has any international work, will submit for the Global Perspectives column.
What's the best thing you've learned from working with nurses and faculty overseas?
Everyone wants to provide the best possible care to their patients to improve, as I had said before, health outcomes and quality of life. Nurses everywhere, it seems to be a common thread, even when I attend international meetings and listen to presentations or speak with nurses. It's always that. And faculty really are dedicated to developing a rigorous curriculum to prepare advanced practice nurses, and they want to meet certain standards so that internationally they are recognized, and it may not be exactly the same, but the best that they can do within their educational system and their health delivery system. And advanced practice nurses in many places are really pushing the buttons and making legislators listen, raising awareness among the public, among the population for acceptance, and also really encouraging nurses to go further, to seek as much education as is made available to them, and to function at a level that is comparable to their education and their training. Nursing worldwide is in a very good place. And next year, 2020, will be the year of the nurse, designated by the World Health Organization. And so that's a big plus for nursing. And so I encourage everyone to listen to colleagues around the world any way you can, by reading, television, whatever method you are able to, but and keep open minds about things you might read anywhere, because as I said, every country has its own challenges, and nurses have their challenges, but they all strive to provide excellent evidence-based care.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.